Hello, everyone. Today is April 14th. It's our briefing today. I've got not as much stuff as normal, which is really good in my opinion, but I've surely got some announcements on different things. Again, I can't be more proud of you as West Virginians on all the stuff you've done, and it's showing itself, and it's showing itself in a good way. I want to say that, Workforce West Virginia, along with our National Guard and all the good stuff, from Scott Atkins and all the people that are making the licks happen every day, and all those wonderful people that are working underneath him, they're turning out really positive results. And not that we want to be compared to our neighbors or to other states, but I'm sure you've seen on TV where there's lines upon lines of people walking all the way around the block and everything, lining up, trying to make applications and everything. And we're surely not doing that. And we've got problems and we've got issues, but we're getting better. And we're getting better really fast. I want everyone to know that I've tried to knock down every possible roadblock in order to get our people our monies. From the standpoint of the National Guard and workforce, we have massively expanded their capabilities. Everyone needs to know that if you haven't received a check yet, we're coming, and we're coming really fast. And so with all that, though, know that as you receive your checks, they'll be retroactive so that you'll be able to receive all your dollars. That's how it ought to be. As far as the self-employed or the independent workers or independent contractors, you are not able yet to file, but that will be happening in very, very, very soon time. And we'll announce when the self-employed workers can begin filing and receiving benefits as soon as absolutely possible. We've even moved in a way on those that are filing for that we may be sending out direct checks, and so in order to be able to expedite all that. From the other announcements are, I'm really concerned about the Wayne Nursing Home. We've got lots and lots and lots of positives down there now. We've got 30 employees that have tested positive, along with 36 patients that have tested positive. We're on it. The National Guard and the DHHR are working closely with the Wayne County Health Department to ensure and try to help in every way possible to get everybody through this. I want to report that from the standpoint of our our Department of Education, rather, and the Division of Tourism, the National Guard, the Department of Agriculture, they have all had a very, very, helping hand in this critical program to be able to get meals out to our kids. Now, just imagine this. We now have a weekly, and weekly is the word, but a weekly capability of administering 1 million meals a week to our children in West Virginia. And this operation is unlike anything we have ever done before, but it's exactly what West Virginians always seem to do in times of real struggle. I want to remind everybody about the census. I keep saying the same thing. It's like beating maybe not a dead horse, but beating a horse that needs motivated. And it's just this: we've all got to be counted. Please be counted. The federal dollars that will flow or maybe not flow to us because you're not counted are going to be detrimental and really substantial. Now, as far as just this, I want to talk to you just a second, on my feelings about where we are. If you look at our positives to date that I get just on my sheet. You know, our positives on the dates of April 8th, we had 67. Actually, let me even go back. On April the 5th, we had 45, then 42, then 21, then it really shot way up. 67 on April the 8th, 50 on April the 9th, 74 on April the 10th. On April the 11th, we dropped down to 41. Since that time, we've gone 16, 33, 14. We felt like the surge would happen in this April 8th through April 10th level. It did. We don't want another surge. We're trending in a great way. And as we continue to trend in a great way, a lot of good things will start to happen, the things that we want to start happening. We absolutely have to stay the course, but you can see the results are really rock solid. And really, if we can keep trending this way, you know, hopefully we can go back to a way of life to where we're working, and even the possibility of school, and absolutely our polls will be open for a June 9th election, and all the good things. We got to be cautious. I don't want to send everybody out dancing in the streets right yet, but absolutely we're getting there, and we're getting better. Now, again, I've told you so many times, we've lost 9 people, and 9 great West Virginians are way too many. You know, I told you about a young kid, 25 years old, and you know, I don't know how in the world that family is surviving that, but it's the same thing if it was your mom or your dad, and maybe they were 88 or 89 years old, but it's a loved one that you miss, and I hate it. I hate it really bad. But I've got to just show you this because it is testimony to what you as West Virginians have done all across the state, and you as businesses that have really sacrificed and all the great stuff that you're doing. But I want to show you a slide of our nation, and if they could put that up real quick. And if you'll look at this closely, it shows the states around us. Pennsylvania has 524 deaths right now. Ohio, 274. Virginia, 154. Kentucky, 104. And Maryland, 262. Now, if you can just think just for a second, we've got all around us, we've got 524, 274, 104, 154, and 262, and West Virginia sitting right in the middle of you with 9. It's 9 too many, but it's one heck of a lot better than anything that's going on around us. And understand just this, there's no other state anywhere close to us that has any kind of results like that until you go way out west, where the populations are few and far between. Remember, we're within a rock's throw of 2/3 of the population of this country, and our borders are so porous all over the place. West Virginians, please, please understand just how good you're doing. And Jordan, if you'll put the states, you know, the states that are close to us slide up, you maybe could see it a little easier without me reading it to you and everything. But you can see right there, the only state you can't see is the state of Maryland, which is at 262. But all the way around you, West Virginia, you can see just how great you're doing. Please keep those 9 in your thoughts and prayers. And please, please know that the odds are awfully great that we're going to lose more. But the least is far, far, far better. I thank you in every way, West Virginia, and I mean it. You've done really, really good. And I can't wait to to be able to see us back to work or back to school or whatever it may be. So let's just keep this trend line going, and we're gonna get through this. Anyway, thank you so much.
Thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. 600 National Guardsmen have completed 367 missions. Just to highlight some of the things that the governor's discussing as we bust this curve and continue to work into phase 2, work from the National Guard in support of DHHR and the local health department at the Wayne County Nursing Home to work the epidemiology and the support needed there. Assistance today at our Veterans Home in Barbersville for training, prevention, PPE, and decontamination and sanitation support. A test going on this afternoon with Kanawha County Emergency Management, Kanawha County Ambulance Authority, the Sheriff's Department, Jan Care, and a couple other organizations working to do a decontamination test and protocols for first responder vehicles. Task Force CRE, our task force that does the training and support mission, has established an additional location in the Martinsburg area to support additional support in those hotspots, as well as businesses and other organizations. Stabilization of our population with the feeding of our children and our seniors. All those are things that the governor and this team talk about related to prevention and support to our population to continue to allow us to do the things that we need to do to break this curve. I want to talk for a minute too about Workforce West Virginia. To Secretary Gaunt, Scott Atkins, Jeff Green, the CIO at Workforce, working with Josh Spence from the Office of Technology and Colonel Pat Chard from the West Virginia National Guard. Last night, they implemented a beta test with Amazon Connect. This morning, the WVU support call center went online with Amazon Connect. 263 calls, only had 2 abandoned calls, a 98.7% of the calls were answered within 60 seconds and entered into the queue, and the duration of the calls lasted 5 minutes and 42 seconds. An additional system going in place to automate some things for folks who have to continue to work with their benefit process. Over the next week, you'll see other of the call centers as well as the regional offices go to the Amazon Connect for the call center support. And that same group of folks doing great work are working next week and the following week on a customer relations management software. Going to the governor's point about double down, triple down, sometimes double and triple down means adding technology, being more efficient and more effective. We know what the mission is we were given by the governor, and we're working hard to continue to implement that to improve opportunities for our citizens going forward. In the future, I'll try to maintain a little bit less on the data and specific numbers going forward, and those will be in the West Virginia National Guard press release if you want specific numbers on types of or amounts of food delivered, things of that nature. Again, on behalf of all the guardsmen, their families who are out, and those of us on the front lines, I want to thank all West Virginians to continue to double and triple their efforts and the great work that's going on as we defeat this threat. Thank you.
All right, thank you, General. Next, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and it's great to be with you today. And like the governor and General Hoyer, the good news is that we really don't have a tremendous amount of new news. People are doing a great job. People are doing a great job of continuing to socially distance and to stay at home. Our percent of people that are infected related to other states is substantially less, 5 times less than the national average. Our case fatality rate at 1.4% is significantly less than the 4% national average. About 2 million people around the world have been infected with the COVID virus, and about 600,000 in the US. And West Virginia is really leading, I think, the country in the response that you, the citizens, have been able to do. We know that around us, even though we're doing great, the areas around the eastern panhandle and around the northern panhandle have many more hotspots. So those are areas that we have to watch. And as we start to think, as the governor alluded to, and as the president has talked about the opportunities to start to begin to consider phase two or repatriation, then there's a lot of things that are going on between DHHR, the National Guard, certainly other governmental agencies to get us prepared to start to come back out again. And as we do that, we know that in many ways, this next stage is going to be much trickier than the first stage. And certainly with the first stage of this COVID-19 pandemic, we know that it's been really important to try to reduce the rate of spread, not to create the surge and overwhelm our health assets and critical care beds. And you and West Virginia have done an amazing job. And we could not be more grateful. And certainly we know that we have saved lives. We know that we have reduced the number of people who have gone to the hospital and who have gotten ill from this. But our work is not done yet. And I think that as we start to work with the governor and give him our thoughts from the health side of the equation, and certainly, we need to balance jobs and the economy and other important elements for the state's future and to help people thrive in the state, we know that we will approach this in some ways as a new normal, that we will likely still ask people as we begin to come back out again to stay socially distanced. For people that are vulnerable, stay closer inside. We probably will recommend people wear masks, particularly in areas or face coverings in areas where you can't socially distance as well. And we will be working with the HHR and other agencies to really augment our ability to do surveillance. So instead of just doing things at the more global level to state, we want to start to be able to identify cases much quicker and then do the case investigation, quarantine those people and the people that they've contacted, and test a lot more so that we can start to become much more precise in what we do. And we believe at some level there'll be a little bit of kind of going back and forth, that we know that as we come back out again, then we will have some more hot spots and areas that we might have to pay more attention to. But based on the really good work of you in West Virginia, as the governor pointed out, our number of new cases, the rate is certainly coming down. And that's exactly what we want to see as we start to anticipate this next phase of repatriation. And, we're about 3 days in and things are looking like they're slowing down. We know, again, we have areas around us that have much more activity. So we'll have to watch that carefully. But as you continue to do the great job that you're doing, we are really in a very good position right now. So we thank you. We don't want you to let your guard down. And this is not over. We're still in many ways early in this game because, as we've said before, the two real things we're waiting for is either an effective drug regimen or drugs that treat this pandemic, this virus. And if we get that, then we can feel more comfortable that if people do go out and get sick, we can help them. And we're finding out more all the time. And or a vaccine. And the vaccine will take a bit, but that's what we have done and ask you to help us do by buying time, keeping people healthy, and continuing to wait for these advances to come up. In the meantime, wash your hands, don't touch your face, stay inside as much as you can, stay physically distanced other than just your nuclear family that you live with, and wearing a face cover outside is a good idea. West Virginia, you're doing great. Don't let up. We have a bit of a road to go, but by doing it together and doing it cooperatively, we are making a huge difference in saving a whole number of lives. So well done. Thank you.
All right, thank you. Next, let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Good afternoon, everyone. A couple of quick items. One, I had a question yesterday with regard to online foster care certifications and whether that number had gone down or increased. DHHR contracts with an entity called Mission West Virginia. We'll have that number up on the screen in a minute. That agency is responsible for taking those online certification requests or inquiries. We are, in the last 30 days, those numbers are up. We are at 161 inquiries in the last 30 days. It's really too soon to determine whether that number results in increased number of foster cares, since the process takes about 3 to 6 months, depending upon the family. Excuse me. We have developed a lot of online training, a lot of online services, and that is now part of the certification process. So families can do much more of this online than they could before. Of course, some of that must be done in person, fingerprinting and home safety checks, and our staff, as I mentioned yesterday, still go out and do those essential tasks that have to be performed to get a family certified. So we still need foster care parents. Regardless of whether that number is up somewhat, we always need foster care parents. West Virginia can continuously step up and provide services for those in need, and our children are certainly high on that list. So we thank everyone for that, and again, thank our staff for that. You can contact Mission West Virginia. That number is up on the screen, either the telephone number or the online Mission West Virginia or wv.org. Both of those are on the screen right now. Only have one other short item, and that is employment. DHHR is continuing to fill critical job vacancies. You can find information about open positions on the DHHR Facebook page or by searching online at governmentjobs.com-careers.wv. So again, we're still continuing the services that we're responsible for providing, and we need staff to do that. So thank you very much.
And then from the surveillance epidemiology side of things, Dr. Marsh spoke to the longer term piece here. And while we've got an enormous task ahead of us, even just currently with the contact tracing and investigation that's been underway, and a lot of really strong work at community levels, we are thinking about this longer term piece, because we know that as we move forward over the next months ahead, that is going to, the contact tracing and our ability to test widely really are key to what we want to be able to do. And so one of the things I think that's really so helpful in the work that you all as communities have been doing in really preventing the spread and slowing down our progression and our surges with this system is not only does it extend time so that we can access a vaccine, it also extends times for the testing capacity to grow, the technologies to develop, so that we can actually manage that. We also similarly have to make sure we continue to build the capacities to do the level of contact investigation tracing we want to do. And so that has included, to this point, certainly adding workforce with the National Guard. And then we recently are just completing some training with occupational medical students to add an additional workforce to that system. So there's lots that's underway, and I think lots that we'll be thinking about as a country in terms of how do we ramp up these and how do we have the capacities testing wise and the newer technologies that may bypass some of the barriers we've had to date. So those are really critical in all our minds. We are thinking about that both as a West Virginia and as a nation with that. In terms of some of our outbreaks we have been seeing, we've had about 16 outbreaks across the state. About 3/4 of those have been in long-term care facilities. Like any new virus, we are learning things as we go, and you always adapt and change policies as you move forward and as you learn more. So that is actively underway. One of the things that is so critical in that setting is your management tools and techniques and the really strong infection control. And so we know that our long-term care facilities have taken that very, very seriously throughout all of this, both before and during outbreaks when they occur. We do offer something called an ICAR, an infection control assessment review, that we've been working with facilities on. We're offering that as they have these outbreaks so that they can look at the measures they've put in place and really review again and assess, are they doing everything possible in that arena. And then we also are moving that up front to the prevention side point. That's where we've been focused as well. So we've reached out to 111 facilities to offer that service. We've completed several of them, have another 20 some scheduled this week. So those are actively underway, both for our long-term care facilities in advance of, and then at the time of any kinds of outbreaks. So that's just such an important, critical piece there. So those are two areas that we've been working on a lot actively.
All right, thank you. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. Our first questioner today is Stephen Allen Adams with Ogden Newspapers.
Yes, Stephen Adams with Ogden Newspapers here. This is a two-part question. The first part, and I feel like this was sort of answered on the medical side of things by Dr. Marsh and Dr. Slimp, but just from the economic side of things, I know some health officials, Dr. Anthony Fauci was talking to the AP today about while May 1 may not be, when everything opens up, he does expect some areas will be able to start to slowly open up on a rolling basis. So part one of my question is, what plans are we putting in place for how that might look going into May? And the other part of that is some states are coming together to create regional groups to work together to plan on opening up some of these restrictions. They understand that obviously, with states so close together and the borders, people are going to want to cross over and that sort of thing. So they're working on plans for how to open up slowly together. And I was wondering if we had any conversations with our neighboring states for how that might look.
Okay, Stephen, let me, I mean, there's pieces of it that I was getting, and there's pieces of it that I was missing, but, we're in constant contact with all of our neighbors, and we're in constant contact with all the different governors, as well as, the president and the vice president and everything. Every especially myself, I'm talking to all kinds of people all the time. The net of the whole thing is just this simple, is we have done amazingly well, but this next phase will be very tedious and very difficult. We want our people back to work, and we want our kids back in school, and we want life back to as close to normal as we can possibly get it. The bottom line is, I don't like any part of telling people, we've got to double down a hot spot, or got to double down from the standpoint of a stay-at-home order and all that. I wish to God above that we didn't have to do anything, but we've saved a lot of lives. And at the end of the day, if we'll just stay the course, we'll be taking guidance from our neighbors and guidance from all the medical experts and guidance from the federal government in lots and lots of different ways in order for us to get our people back to work. And trust me, we'll get our people back to work very soon because of all the good stuff that's going on right now. But let's stay the course so we don't have a big time setback and then we can't get them back to work.
All right, thank you. Next, let's go to Kenny Bass with WCHS.
I have a question about the Jackson County situation. There is a nursing home in the Ripley area where information about COVID-19 positives has maybe not been as forthcoming or as available as instances with previous nursing homes, like Glendale and Morgantown was amazing with the information, and the Charleston situation, and even the one in Wayne County. How closely is the state looking at elder care in Ripley, and are you in communication with those people? And I know your level of concern about nursing homes is very high. Do you have any concerns about that one in particular?
Let me start off by saying, Kenny, from day one, the very first people that I met with were the nursing home people. And from day one, any state that wasn't on high alert with their nursing homes was asleep at the switch. That's the very first thing that I did in regard to restricting, visitation to our nursing homes. So it has been the number one focus with all of us all along. But as far as the particulars about that nursing home in Jackson County, maybe one of the health people can give you a better answer than I can give you on that.
I can speak to that one. We have been very actively engaged there. They have actually been doing a great job of really looking at the situation, identifying what the linkages are and the issues are, putting in place exceedingly strong infection control measures in that facility, and working very closely. So I really think we are regularly in contact with them. We are clearly working with them closely. And I think the communication piece is you can speak to them more locally about. But I think they have been working very actively with good partnership and collaborations between a variety of sectors in public health and the healthcare facility. So to really make sure that they protect the residents and the staff that situation.
All right, thank you. Next.
Let me add one more thing on that and everything. I've got to talk just a second about this, and that's this. You know, when we have to draw more attention or more restriction to hotspot areas, I mean, everyone should know going in that that's surely not something that anybody here wants to do. I mean, that's the very last thing that I want to do in life, because I'm a business guy. And that's the last thing that I want to do. But I want, you know, Kenny, you mentioned Jackson County, and I want everyone to know just this, that my first and foremost thing is going to be listen to the experts. And the experts are telling us point blank that Jackson County has trended the highest percentage in the state 3 days in a row. Now, and right in between Jackson County, we have two counties that are already under the executive order, and that's Cabell with 25 positives and Wood with 21, and Jackson County sitting right in between them with 30. You know, you've got to understand that I hate the inconvenience. I know there's terrible inconvenience, but at the end of the day, my goal is, my number one goal, hands down, is to try to save lives. Now, I know everybody wants to do that, but at the end of the day, I've got to make a decision, and they're tough decisions. And gosh, I don't want to do anything that causes further inconvenience to anybody. But first and foremost, I don't want to look back with some kind of outbreak that ends up costing us more lives and say, Jim, you could have done better. And absolutely, in this situation, so we made the decision with the guidance of the experts, and first and foremost, they told me what we needed to do. That's why we moved the way we did in Jackson County. And I hope and pray that our people are on top of the nursing home in a strong way. And you know, and if you look just at the trend of everybody around, whether it be Kanawha or Wood or Jackson County or Cabell, they're all right in the same network. And so that's why we did what we did.
All right, next, let's go to Amanda Barron with WSAZ.
Hi, everyone. Amanda Barron with WSAZ. I know lots of people are working to update numbers and dashboards, and it's a huge task, but I want to ask today about the timing and how that impacts projections and decision-making. For example, Wayne County is reporting 67 cases, and I know it takes time to get those updates in, but the website only reflects 19 of those cases right now. So is that giving false hope to our percentages that they're better than they actually are? Is our software up to date? And is that process not quick enough to give us an accurate picture of maybe just how well West Virginia is doing?
Okay, Clay or somebody's got to answer that. I can't answer that.
Go ahead, Kathy.
Sure. Amanda, good questions. What's really critical there is that we have knowledgeable information at the local level and that we're linked in with them. So what's really important there, we know exactly when those cases came in. They are managing that piece. Again, it's reflecting what was the testing from a few days before. They've been putting in place the prevention measures already. So those were already in place. The testing helped look at that more fully. So I think what's really critical there is they know exactly what they have currently there. We are in communication with them. We know that it takes time to update the numbers on the website, but we're not working on those numbers for the website. Those are to use for trending and for understanding what's happening overall. We know that these situations, especially when you have large jumps like that are related to a particular facility or a particular outbreak, those are contained situations there. It's not a widespread community issue. And so it actually, we know it functionally, we know what's happening in real time, and then the website follows. The website is really meant, the dashboard is our official case counts that we use across the state, that we share with CDC, that go into national case counts. And so there, it does take a day or two to get those into the system. It does take information to be uploaded through the case investigation. We want to make sure that the data is accurate.
All right, up next, let's go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Yesterday, Governor, you said that the only thing the state was really lacking in terms of PPE was gowns and gloves, and that you brought that up during the call with Vice President Mike Pence. Could you update us on where we are with that and what the federal government has said we'll be getting?
Okay, I want to make perfectly clear. I didn't say that was the only thing we needed. I said that was the immediate need. And I brought it up with Vice President Pence yesterday. I don't know where we are any further than the fact that they took our request, and I'm sure they're processing it, as well as our extension on the National Guard to 60 days versus 31 days. But maybe Clay, you guys could talk, or maybe General Hoyer, you could talk about, from the standpoint of all the equipment and protective equipment that we have, and what our needs are.
Yes, sir. So after the governor talked with the vice president yesterday, we were in contact with FEMA Region 3 to work to address the numbers that he discussed. In addition to that, we've sourced some outside supply for those two particular areas, and we do have numbers that will come in later this week and the first of next week to help us address that. In addition to that, we're looking at, we have actually made a procurement of 2 million gloves. However, the availability of those gloves will come in sequentially as they're produced. So that will help us address that piece. In addition to that, this week, starting actually yesterday, a company in Spencer, West Virginia, that also has a site in Florida, has beginning to make reusable gowns for us based on some material that we've been able to secure, just like the masks. So looking at a variety of different sources, continue to work with FEMA based on the governor's request to the vice president, and we'll continue to work those numbers over the next several days.
Governor, if I could just make one other question or one other comment. I think that the other important point, and General Hoyer had mentioned it before, but as we're really making a big effort, not only to produce more and acquire more, but come up with ways that we can decontaminate existing materials that we can reuse. So as we are able to get a reusable inventory, we believe then that we can make our supply go much longer and help outfit even more of our needing entities, not just the acute care hospitals or the long-term care facilities, but also thinking about first responders and essential workers.
All right, thank you. Next, let's go to Lily Bradley with WOWK.
Hey there, Lily Bradley, WOWK. Governor Justice, this question is, I think, maybe for you. Right now, schools are closed till the end of the month. You talked about possibly opening them back up before the end of the year. When can we expect an update or a decision as to what the future will look like for the kids in school?
Well, we've got ourselves shut down until the end of April right now. If I could only give you just an opinion, my opinion is still very hopeful that we're going to be able to at least go back for some period of time, whether it be just a couple of weeks. And that's, again, upon the guidance of experts. Clayton Birch, our superintendent of schools, and all of his disciples are telling him that for summer learning and for closure and so many different things, from every aspect, if we have the opportunity to be able to go back to school for 2 or 3 weeks at the end, it would be very, very beneficial to our kids, beneficial to the learning process, and on and on. So from the standpoint of when we're going to either be able to announce that we are going to have the opportunity to go back, or we're going to have to extend, or we're going to have to say, we're going to have to throw the towel in and say, hope is gone, we're not going to be able to extend. And so those decisions will be made with the experts. There's talks going on every day, and as soon as we know more, we'll report, just like I'm reporting to you today, that things are better. I'm telling everyone, be cautious, stay the course, but things are better, and let's just hope and pray that things are just going to keep getting better and better, and then maybe we can go back to living our lives in some way. Maybe it'll be modified just a little bit, but living our lives in a lot different way than we're doing right now.
All right, thank you, Lily. Let's go next to Taylor Stuck with the Herald-Dispatch.
Hi, this is Taylor with the Herald-Dispatch. I was wondering if someone could explain the guidelines or the protocol for determining what nursing homes or long-term care facilities get the more robust testing and help from the National Guard and such like that. Wayne County's case came at the same time as the Woodlands Assisted Living has a positive case, but they haven't had testing like they did in Wayne County. So I was just wondering kind of what goes into that decision.
Taylor, I can speak to this too. And I think this is an area where we are evolving and changing. When you have a new virus and a new situation, you are constantly looking at what are you finding, what are you doing, what's your policies, and you shift those. And so the fact that you see changes are actually a good thing, because it means we're learning more about the system and about the structures. So I think we are actually adapting and changing our policies in this arena. It's also important to recognize that there are parts of the investigation that are really the most critical ones to make sure you get the right prevention measures in place. And so those are happening. And then we also need to think about what are we learning more with these other kinds of testing methodologies, which also impact and change things. So that is evolving and changing as we go, and we are making those shifts. And that's happening not just here, it's around the country. And there's a variety of discussions around this arena, but we are shifting our policies with that as well.
Okay, thanks, Taylor. Next, let's go to Phil Kabler with the Charleston Gazette-Mail.
Governor, do you believe it will be necessary at some point to furlough state employees, as virtually every private sector business has done with their employees?
And the reason I don't is just real simple. Phil, I said weeks ago that from the standpoint of the inner workings of business and the dollars, from the standpoint of the economic stimulus, that is all right in my wheelhouse. And I've said over and over and over repeatedly, I think that there's going to be real dollars flow into West Virginia to be able to backfill revenue or our workers or whatever it may be. And I think that they will flow in a way that didn't really necessitate us having to go to a special session and invade the rainy day fund and all that. And we still may have to do that. Don't get me wrong. I don't know absolutely specifically yet, but I know enough to believe that I do not think we'll have to furlough or lay off anyone. I don't think we'll end up having to cut benefits or cut programs in a harsh way, if in any way. And the other thing, I think absolutely our shortfalls are going to be backfilled, from the federal government. I think that's all in the process right now. And I think really and truly, and I'll add one other thing to everybody else out there, as I'm watching all the potentials that could happen adversely or positively to the economics of the state, I tell everyone, look every way you possibly can as an individual, as a self-proprietor, as an independent contractor, whatever it may be, look as diligently as you possibly can to all the different ways that you qualify for stimulus dollars that will be either that are rolled out right now or will be coming. But I absolutely don't believe that in any way, shape, form, or fashion that we're going to have to lay off anybody.
All right, thanks, Phil. We have time for one more question. Let's go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor, and this is for you, and also as well for Dr. Marsh. Governor, for you, could you react to the assertion that President Trump made yesterday that he has total authority over governors to lift these restrictions that have been put in place? And the part for Dr. Marsh is, as we talk about plans to reopen things, how long are we expecting the stay-at-home order to be in place? Because the way I understand it, these projections have some of these orders and social distancing practices in place through May 30th.
Well, let me take a stab at it first, Clay, and then you can follow up behind me. But first of all, I want us to know this. We have a great president that's under unbelievable pressure. I know from what I'm trying to do in West Virginia, and he's trying to do that on a multiple of many times. And it's easy. It's easy to second guess, and it's easy for him to maybe, his words of, he has total control over the states and whatever like that and everything. To be perfectly honest, I don't know. I just don't know, but his technique of delivering that, he may have very well been thinking a lot differently than maybe the way that it was delivered. But what I would say to you is just as simple as this. Look at the volume of work that has been done. Look at what we're trying to contend with here. Look at the fact that we could have lost hundreds of thousands, if not millions of people, and all the stuff that has been done, and we've still lost 23,000 plus people. It is a really tough deal. And so from that standpoint, I can't answer. I cannot answer if it's accurate or inaccurate and everything, but I can tell you that we should step back and give passes on opinions. Now, the other thing is, well, I'll let Clay answer the other thing because he could do that. He's more qualified on that than I.
Well, thank you, Governor, and thank you, Dave, for the question. What we have done consistently from the health side is make recommendations to the governor. And what he has done consistently, and my experience with him, has always taken the road that protects the health of the people of the state. So I think that the question you ask is uncertain. As we know and have said consistently that this is a once in a lifetime event, that we can't predict exactly how it's going to go, that we follow it day to day to day. And as we have said, our hope is that the number of new cases continues to go down, as the governor talked about, that some of the surrounding area, the border areas, particularly the eastern panhandle and the northern panhandle, that starts to go down a little bit too, because we know this virus won't pay attention to those state lines. And as we see what is going on, and the governor decides what is the best thing for the state and the businesses of the state, and looks at what the president is recommending, then we will constantly give our input to the governor. But it's really his decision. And as he said, that's a lonely place to be sometimes. But I would say for our citizens that you should take heart that in my experience with Jim Justice, he has never made a decision that is not in the best interests of the health of the people of the state. And I feel certain that he will take that into critical thinking as far as the balance about when to open, how to open, and what we recommend for our citizens. Thank you.
And let me just follow up, and Dr. Marsh or Clay, I really appreciate the kind words. Without any question whatsoever, we won't do anything if we think, or the experts are telling me, that it is going to endanger us. Now, we've got to go on about our lives. We know that. and everything. And every day we get in an automobile or whatever, we know that there's risk. But absolutely, we will only go, first and foremost, if the experts and everyone believes that it's safe and it's absolutely the prudent thing to be able to go. I hate like crazy all the inconvenience and everything else. I hate it in every way. But first and foremost, my responsibility is to look out after the individuals and look out after all West Virginians. And when you look at this map right here, you know, you'll see right real fast that what we're doing, and I commend all West Virginians in every way, what we are doing and what we've done has been right so far.
Governor, I'll turn it back to you.
Well, I don't have anything, you know, to wrap up because we've said, you know, about everything that I had notes on as we went forward, except the only other thing I would do is just what I've already said. Please stay the course. You're doing beautiful work, West Virginians, and we're saving lives, and you know, please keep those 9 in your thoughts and prayers in every way. And the only other thing I would say is work every angle that you know that is feasible in regard to these economic stimulus dollars. They're very significant, and just because you qualify on one sheet, you may very well qualify on another sheet as well. And so remember that, you know, absolutely, if you qualify for X dollars over here, there may be the ability to qualify and receive those dollars that are completely forgivable over here. And you may be able to apply for a loan that you badly need in a business to get by or whatever it may be over on the other side. So really, really watch and use us to try to help you, and use every resource you can. But because every dollar we have come into the state of West Virginia is the dollar that we really need. So thank you so much, and stay the course. God bless you all.